Hey guys, Nurse Mike here from SimpleNursing.com. Today we're tackling pharmacology with a focus on antibiotics and anti-infectives, breaking down the big medications that you need to know for your exams. Oh, and here's the best part. We've got 28 study guides in the membership area, one for each medication, popping up in the top right corner as we go through them. So be sure to grab those study guides and let's make sure this information sticks. All right, let's jump in.
Now for the 6 top test tips for antibiotics. Guys, write these down. Number 1, we always finish the med to prevent the superinfection. We want to prevent creating any superbugs like C. diff or MRSA. So guys, the key words: take until all the med is finished, and do not stop taking when feeling better. Guys, always educate the patient to finish these meds. Number 2 is accidental pregnancy for Cyclins and cyclings. So guys, remember the 3 C's. Childcare for Cyclins, like Penicillin, and cycling, like Doxycycline. Key words here for the NCLEX is oral contraceptives are ineffective. So we, keyword, use additional contraception, like an IUD. Now test tip number 3, no alcohol. Guys, antibiotics are hard on the liver, and so is alcohol. Now, test tip number 4, no food for MTF. So just think, move the food. M for macrolides, like Azithromycin. T for tetracycline, like Doxycycline. And F for fluoroquinolones, like levofloxacin. Keywords here: take on an empty stomach with a full glass of water. Now, number 5 is no sun, so avoid fun in the sun. So remember, FTS. F for fluoroquinolones, like levofloxacin. T for tetracycline, like doxycycline. And a big one here is S for sulfa drugs. Just think S for sunburns. A big drug here is trimethoprim sulfamethoxazole. Fancy words for the brand name Bactrim. And other sulfa drugs are sulfonylureas like glyburide, the oral antidiabetic, and even diuretics like thiazides and loops. These have sulfa derivatives. So some key words on the exam: their photosensitivity, which means they're sensitive to light. We always avoid direct sun exposure. And guys, a huge risk for sunburn. So wear sunblock and avoid the sun. Now lastly, number 6, super toxic to the kidneys and ears are the ones ending in mycin, like Vancomycin, Gentamicin, and Neomycin. Guys, just think it's a sin to give a mycin, since they're super toxic. So cover your ears and your kidneys. So with mycin, the key points here, guys, write these down. Peaks and troughs. If they're too high, then the kidneys will die. And guys, if the trough's too low, then the infection will grow. So we always report signs and symptoms of toxicity. First things first, ear damage, aka ototoxicity. Keywords for the NCLEX is vertigo or loss of balance, tinnitus or ringing in the ears, and for kidney damage is nephrotoxicity. Guys, we report immediately increasing BUN and creatinine, those 2 kidney labs. So creatinine over 1.3 just means bad kidney. And guys, BUN over 20. These numbers should not be increasing. Now lastly, urine output 30 mLs per hour or less usually means kidneys are in distress. Now a little side note here, don't let the NCLEX trick you. Guys, mycin are the most toxic antibiotics. Not thromycin like azithromycin, and not floxacin like ciprofloxacin. Guys, yes, they end in sin too, but are not mycin. So remember, mycins are the most harmful here. Now for broad-spectrum antibiotics are Cyclins and sporins. Guys, the mechanism of action is that it weakens or destroys the bacterial cell wall, causing lysis or death. So for penicillin, they end in cillin, like amoxicillin or ampicillin, and even piperacillin and tazobactam, which is kind of the outlier there. Now, cephalosporins start with ceph, like cephalexin, brand name Keflex, and cefazolin, and even ceftriaxone, the brand name Rocephin. Now, both are considered pregnancy safe and breastfeeding safe, but there are some specific differences. For example, penicillin causes accidental pregnancy since it bumps the pill. Again, guys, the key words here are oral contraceptives are ineffective, and use additional contraceptive like a IUD. And C for cephs can cause C. diff, guys. They do not treat it. Now, this was a common test question on HESI and ATI asking for the treatment of C. diff. No, 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 guys. Cephs do not treat C. diff. So the key point and memory trick here are the 3 C's. C for cross-sensitivity or allergy to both cephs and Penicillins. Guys, the key point is checking the allergy before giving either. Since these drugs are structurally and chemically similar, cephs and Penicillins, they can't be mixed. And an allergy to one usually means an allergy to the other. Now, you can mix nearly every other antibiotic except cephs and Penicillins. And 40% of students usually get that wrong on exam. So common NCLEX terms are anaphylaxis reaction between Penicillins and cephs. Guys, the nurse should always clarify the prescription and always request a new medication. Now, anaphylaxis occurs more with penicillin than any other drug. And since allergies can range from mild to severe, guys, the key point during a reaction, write this down. Stop or hold the medication, then assess the type of reaction, and always listen to the lungs or auscultate the lungs. Lastly, epinephrine prepared to administer. We're always assessing for the type of reaction first. Common on the NCLEX and exit exams, we do this before calling the doctor or HCP and before calling pharmacy. Guys, assessment always comes first and then intervention second. Now, as far as administration with Penicillins, the key terms here are we take with food if GI is upset. So nausea, vomiting, and diarrhea. And we shake well before using it. Always shaking it before we are taking it. Use a correct measuring device, Doppler or oral syringe. Guys, never a household spoon. Usually a common distractor there. And lastly, common side effects. Cephs, we usually get diarrhea, but commonly antibiotics cause diarrhea anyways. And Penicillins, big key word here is bleeding, so we monitor the platelet count. Now for the big guns, for the superbugs, known for their very toxic effects, killing the kidneys and the ears. So we have 2 classes of drugs which kill the 2 kidneys and ears when they're toxic. First is the glycopeptides class, including Vancomycin, which we can think is very toxic. And we also have Aminoglycoside class, including Tobramycin, Gentamicin, and Neomycin. Now again, both these guys end in mycin, so think it's mycin to give a mycin, since they're super toxic to the ear and kidneys. And the main thing is to monitor the drug concentration in the blood. Again, remember, too high and the kidneys die, and too low, the infection grows. So the key words to know for the exam is peaks and troughs. Always checking 15 to 30 minutes before the next dose or before the next administration. Guys, we always draw and review the levels. The range must be between 10 and 20 to be in therapeutic range. Again, guys, too high, the kidneys will die. So we always report and hold over 20. And we're reporting signs of toxicity, ear damage known as ototoxicity. So we're monitoring for hearing and balance changes. Again, the NCLEX keywords here is vertigo or loss of balance, and even ataxia, the inability to walk, and also tinnitus or ringing of the ears. Usually these are the first indications of kidney toxicity. Now, speaking of kidney damage, nephrotoxicity, mentioned over and over in many quiz banks. Guys, we're reporting and notifying the HCP of increasing BUN and creatinine. So creatinine over 1.3 means bad kidney, and BUN over 20 is definitely not good. And lastly, guys, urine output 30 mLs per hour or less usually means the kidneys are in distress. Now, specific to vancomycin, given for very serious infections like MRSA and C. diff in the gut. Guys, these bugs are hard to kill, so vanco is some pretty powerful stuff, and consequently, it burns during administration. So nursing considerations, think vanco burns the veins, causing thrombophlebitis. Or vanco is very irritating to tissues. So it's usually given via PICC line as a preferred route. So the key point is to assess the site every 30 minutes for pain, redness, and swelling. Guys, make sure the IV is working and patent before administration. Now, the next big key term is red man syndrome, caused by rapid infusion. Now, this is when we have a sudden onset of severe hypotension or low blood pressure, flushing and pruritus, basically itching, and a big red rash on the face, neck, chest, and extremities. Again, it's not an allergic reaction, so red man's is from a rapid infusion. So simply slow the infusion. So once again, the key words is monitor blood pressure, guys. That's the biggest priority. And infuse slowly, at least over 60 minutes. Remember, fast infusion means flushing. Now, the NCLEX wants you to be a safe nurse and wants you to know the difference between the common red man syndrome and the deadly anaphylactic allergic reaction. So guys, the key words to look for anaphylaxis is write these down. Hives, angioedema, and wheezing. Guys, any respiratory distress or sign and symptom. Guys, this is not red man syndrome. This is a very serious allergy. So immediately stop the infusion and administer epinephrine. So remember the acronym EPI for when to administer epinephrine. E for edema or angioedema, P for pruritus and hives, and I for inspiratory and expiratory wheezes. Now lastly, don't get tricked on the NCLEX. Vancomycin does not affect magnesium levels. So there's no effect on mental status or DTRs. This is usually magnesium. And there's no effect on nausea vomiting like most antibiotics. So there's no need for anti-nausea meds. Now, as far as aminoglycosides, the indication is used to treat infections in cystic fibrosis. And it's different than vancomycin in that there's no red man syndrome. And its mode of action is a little bit different in that it blocks the synthesis of bacteria to stop the bacterial growth. But guys, the NCLEX does not focus on this. It rather focuses on ways that the drug can harm the patient. So for toxic effects, the key point here is that it's very toxic in combination with vancomycin. So ear toxicity as well as kidney toxicity, aka ototoxic and nephrotoxic. You may need to stop the medication to prevent deafness. So guys, always notify the HCP of increasing BUN and creatinine. The key word here is increasing. So you have to know your kidney numbers. And guys, we have an increased risk for toxic effects in the elderly populations as well as those with decreased renal function, as well as when giving in high doses. Now, a common distractor on most select all that apply questions is the normal effect of muscle aches and cramping. Now, it's contraindicated in patients with neuromuscular diseases, but for patients without the disease, guys, it's a normal finding. So there's no need to report or notify and no need to stop the infusion. This is a very common mistake most students make on exit exams as well as the NCLEX. Next up is macrolides ending in thromycin like azithromycin or erythromycin. Guys, yes, it's true, they sound a lot like our other mycins, but these are thromycins, not just mycin. So it's not too hard on the renals or ears, but they're dangerous in their own way. So the key points to write down here is prolonged QT intervals. That could lead to cardiac arrest. So we always monitor the ECG and report changes to the doctor or HCP. So the memory trick is thromycins, they throw the ECG wave for prolonged QT intervals. Now they're also hepatotoxic or liver toxic. So we monitor liver labs, the ALTs and ASTs, and report increases to the HCP. And guys, be careful with acetaminophen for fever during an infection. Tylenol is very liver toxic. Now, common side effects here, so don't be tricked. Common test questions asks if you stop giving the medication during nausea and vomiting, fever, or decreasing WBCs. Guys, nausea vomiting is common since it's taken on empty stomach. Fever is expected during an infection, so we keep on giving. And decreased WBCs means the infection's improving, so don't be tricked. Next up is tetracyclines ending in cycline like doxycycline. Now the key points for the exam is it's not pregnancy safe, tooth discolorations, as well as sunburns, so we teach patients to wear sunscreen. So the memory trick is thinking of a person that's cycling on a bike. Now, cycling is dangerous, so it's not safe for pregnant mothers. You can get bugs in your teeth while cycling on a bike, leading to tooth discoloration. And use sunblock when out cycling around. Now, the big indication is mainly used for skin acne, and the mechanism of action is that it blocks protein synthesis to stop bacterial growth. Now, for patient teaching, the big key terms for the exam is number 1, use additional contraception. Guys, accidental pregnancies are very common due to the decreased effectiveness of oral contraceptives. Number 2 is take on an empty stomach for best absorption, not with food, usually 1 to 2 hours before or after meals. Now, third, the biggest one here, guys, write this down. Sit up 30 minutes after taking. Do not lay down. The pill-induced esophagitis is really the biggest side effect. We're talking bad heartburn that can lead to scarring of the esophagus. Guys, that's very dangerous. And number 4, always avoid calcium products which block absorption. Keywords are no dairy, no antacids, and even no iron. Not technically a calcium product, but we also avoid the iron. Next up is Metronidazole, brand name Flagyl, ending in Dazzle. So the key points here is it's the number 1 drug used to treat C. diff infection, that superbug inside the gut. Now guys, write this down. The NCLEX will try and trick you with ceftriaxone, which actually causes C. diff. Now majority of students get confused and get this wrong. Now it also treats STI, or trichomoniasis, basically a sexually transmitted infection. This term came up a few times in the HESI exit exams. So think dazzle in metronidazole like there's nothing dazzling about C. diff or STIs. Now the next key points are to avoid ETOH or alcohol both during and 3 days after the treatment. Now this was mentioned in several sections in both ATI and HESI. Guys, patients will have violent vomiting and cramping if alcohol is consumed during or after treatment. Now the side effects that are normal and no need to report are number 1, dark urine or discoloration, brown and rusty, as well as metallic taste. So just think Metronidazole has a metallic taste. Now the deadly side effects, guys, report, please, any new rash or skin pilling. This is likely Stevens-Johnson syndrome, which is necrosis of the skin and mucous membranes. So always teach patients to report these immediately. Now for the memory tricks, we use Metro for metronidazole, M for metallic taste and dark urine. Now again, this is normal. E for ETOH, basically avoid the alcohol. T for it treats C. diff and that STI, trichomoniasis. And R for rash and skin pilling. That is what we report. And O is for O, not dazzling, because there's nothing dazzling about C. diff or STIs. Now for the 3 UTI medications. First on the list is sulfonamide antibiotics, or trimethoprim sulfa. Brand name is Bactrim. Now the mechanism of action is it stops folic acid synthesis. So for side effects and teaching, the word sulfa is in the drug, which makes it a sulfa drug. So remember the acronym SULF. S is for sunburn, so we teach patients to use sunblock and avoid the sun. U is for urine crystals and specific gravity that's high, which means the body is dry. Since sulfas really dry out the body and create urine crystals, aka kidney stones, we teach the patients to L, love the water, always drinking 2 to 3 liters per day. And F, folic acid, we have to take daily. Now, contraindications. We have hypersensitivity to sulfa drugs. We always assess for allergies to sulfonylureas, like glyburide, the oral anti-diabetic drug. Now, we saw that one big on the HESI exit exam. So the 2 key points here is if you have a rash on a glyburide, that's a potential allergy to sulfa drugs. And second, it's not pregnancy safe. Next is fluoroquinolones, levo and ciprofloxacin. Brand name is Levaquin, given to pneumonia and UTI patients. So the key point here is to avoid sun, or keyword, direct sun exposure. And also A for Achilles tendon rupture, Now that's a huge test tip right there, guys. Write that down. We teach patients to report new muscle pain, and a big contraindication is tendinitis. So a memory trick is fluoxetine, we call fall oxycin, since you can fall with an Achilles tear. Or flexicin, since it hurts when you flex your calf. Now lastly, nephrotoxicity is rare, so guys, don't get tricked here. Many students want to avoid fluoxetine when creatinine BUN is high. So students get confused with fluoxetine because it sounds very similar to mycin and vancomycin and gentamicin. Guys, those are the antibiotics that kill the kidneys. So be careful with those mycins and not fluoxetine. Now our last drug is not an antibiotic. We have phenazolpyridine. Our brand name is Pyridium. It's a UTI analgesic given for pain relief during that burning and irritation of the UTIs. So some instructors stress the pyro in pyridine like a pyro fire, since it's used to ease the fiery burning sensations of UTIs, and since it turns the body fluid red and orange like a fire. So the key point here, guys, write these down. It's normal. There's no need to report those red and orange urine and body fluids. But we do report liver toxicity symptoms, like yellow skin and sclera. This is known as jaundice. Now that was a big HESI question. Now, since pyridine stains the underwear and clothing and bedding, we teach patients to wear sanitary pads and also wear glasses instead of contacts while taking this med. And we also teach never stop antibiotic therapy, not even when you're starting to feel better. Commonly, patients feel better and then they stop taking their med and think the infection's gone. So when they stop taking their antibiotic, guys, this is a big no-no. Always teach clients to finish the entire course of antibiotics. Now that is always on exams.
Now let's look at some top missed questions from our NCLEX question bank, created by the very people behind the NCLEX itself.
What is the best action for the nurse to take before administering amoxicillin to a patient with allergies to lefloxacin and ceftriaxone? So guys, the NCLEX wants you to follow nursing process. Always assessment of the patient first, intervention second, and then reassessment. So number one, clarify the order with pharmacy. No, guys, we don't do this before assessment of the patient. Option two, ask the patient about the type of reaction they had to ceftriaxone. Yes, guys, this is the correct option because cephs and cillins have the cross-sensitivity here, aka allergies. So the NCLEX wants you to do key term, clarify or assess the patient first. In this case, we're assessing the type of reaction. Now, the deadly anaphylactic reaction involving respiratory issues is the thing that we're looking for there. Now, option three, notify the HCP of the allergy. Guys, not before assessment. We always assess first. And option four, we don't do. Administer meds. No, we don't do that. Question two, which medication can cause yellow sclera and clay-colored stools? Select all that apply. Now, guys, the big thing here is liver toxicity. Key term is jaundice. So, yellow sclera of the eye or skin, and even clay-colored stools. Azithromycin and phenazolpyridine. So, guys, those are the two ones that are most liver toxic. All the other ones are not as liver toxic. Now, question three, a patient is in sepsis and prescribed several antibiotics during their hospital stay. What patient teaching should be included? See exhibit of list of medications. So guys, levofloxacin and doxycycline, both no sun exposure. And cycling, guys, is not baby safe. Just think about cycling on a bike. It's not safe for pregnant patients. And vancomycin, remember, these are mycins. They kill my kidneys. It's my sin to give a mycin. So guys, creatinine over 1.3, bad kidney. Urine output 30 mLs per hour or less means the kidneys are in distress. And azithromycin, guys, it throws those QT intervals and throws the liver out of whack. So once we know that, the options are easier. So option one, avoid direct sun exposure. Yes. Number two, oral birth control is ineffective. Yes, that's correct. Number three, take until symptoms subside. No, guys, a big thing with antibiotics here. We take the entire medication, finish it out, or take the full course. And no, we do not stop when we're feeling better. Number 4, monitor QT intervals. Yes, guys, for that thromycin that throws or prolongs those QT intervals. How about number 5, supplement with vitamin B6? Guys, no, that's usually for INH, a TB medication. And lastly, number 6, monitor creatinine and BUN. Definitely for Vanco or any type of myosin. Kidneys, guys, gotta monitor those kidney labs.
Thanks for watching. Did you know you can unlock beautifully handcrafted study guides, packed with key points and memory tricks from all our videos? Plus, you'll get access to over 1,200 exclusive videos not on YouTube, all neatly organized by nursing school topic, to make that complex nursing knowledge actually stick. You'll also gain thousands of practice questions written by current professors and actual NCLEX writers. So for access to all this and more, click right up here or visit SimpleNursing.com. And don't forget to subscribe to our YouTube channel. Happy studying, and we'll see you in the next videos.